Did you know certain intimate behaviors might be connected to a growing health concern involving throat cancer? I'm Dr. Berg, and today, diving into an important topic highlighted by the Uganda Cancer Institute, the link between specific practices and oropharyngeal cancer. This is vital information to keep you and your loved ones informed and safe. Hit that subscribe button, and let's uncover this crucial topic together. I was amazed when I first learned about this connection, and the Uganda Cancer Institute is raising awareness about increasing cases. There's a lot of confusion out there, with some mixing up throat cancer and esophageal cancer. Today, I'll clarify the differences, break down the science behind this health risk, and share practical steps to protect yourself. You'll be surprised at how relevant this is. Stick with me to stay informed. Let's start with the basics. Throat cancer isn't just one condition. It includes cancers of the pharynx, the tube behind your nose and mouth, the larynx, your voice box, and the tonsils. Oropharyngeal cancer, which affects the tonsils and back of the throat, is the one tied to certain intimate practices. Unlike esophageal cancer, which impacts the food pipe, throat cancer occurs higher up. The Uganda Cancer Institute has noted a rise in oropharyngeal cases, driven by a surprising factor. Let's explore. The key factor in oropharyngeal cancer is human papillomavirus, or HPV, a common virus also linked to other cancers. In the US, about 70% of oropharyngeal cancers are related to HPV. How does it reach the throat? Through specific intimate contact. Research shows that having multiple partners over time can increase the likelihood of this cancer by up to 8.5 times. In Uganda, changing social patterns are contributing to more cases. I was surprised to learn that a UK study found 80% of adults engage in this practice, yet only a small number develop cancer. What's behind this? Let's dig deeper. HPV, particularly high-risk types like HPV-16, can persist in the throat's tonsil areas for years. Most people clear HPV within 2 years, but if your immune system is weakened, perhaps from smoking or stress, the virus may cause cellular changes over time. Men are twice as likely to develop this type of throat cancer, possibly due to differences in exposure. I've seen patients shocked to discover a persistent sore throat was something more serious. The Uganda Cancer Institute emphasizes early awareness to catch issues sooner. Oropharyngeal cancer can be subtle. Watch for ongoing symptoms like a sore throat, ear discomfort, difficulty swallowing, a hoarse voice, or a neck lump. Some patients I've worked with dismissed these as minor issues, like allergies, for months. If symptoms linger beyond 2 weeks, consult a doctor. Early detection makes a huge difference. HPV-related throat cancers have an 85-95-year survival rate when caught early, compared to 25-40 for cases linked to other causes. The Uganda Cancer Institute encourages regular checkups to stay proactive. While certain intimate practices are a significant factor, other habits can increase the risk. Smoking can weaken your body's defenses, making it harder to clear HPV. Excessive alcohol consumption also plays a role. A diet lacking fruits and vegetables may limit antioxidants that support health. I've seen patients with combined risks like smoking and varied social habits face higher chances. In Uganda, where tobacco use is prevalent, these factors are contributing to more cases. The good news? You can take steps to reduce your risk. A powerful tool is the HPV vaccine. It protects against high-risk strains like HPV-16 and works best when given before exposure, ideally around ages 11-12. Countries like Australia, with over 85% vaccination rates, see strong community protection. Uganda is working to boost vaccine access, but globally, rates differ. Only 54% of US teens were fully vaccinated in 2020. I encourage parents to consider early vaccination for their kids. It could prevent health issues decades later. Making informed choices about intimate practices can lower risk. Using protective barriers during close contact doesn't fully eliminate HPV, but can reduce its spread. Being selective with partners also helps. I've guided patients who lower their risk through mindful decisions and consistent precautions. In Uganda, health campaigns are spreading this knowledge. Though awareness is still growing, sharing this information empowers everyone. Your daily habits make a difference. Avoiding smoking and moderating alcohol supports your body's natural defenses. Eating nutrient-rich foods like broccoli, berries, and salmon provides antioxidants to keep you strong. Staying active with regular exercise also boosts your system. I've seen patients improve their overall health with these changes, reducing their risks. Uganda's health experts promote a balanced lifestyle to address rising throat cancer cases. You're in control of your wellness. Let me share a story. John, a 45-year-old patient, had a sore throat for months. Tests showed HPV-related oropharyngeal cancer. He hadn't smoked, but had varied social experiences in his younger years. With early treatment, he's now healthy again. John got vaccinated afterward to guard against other HPV types, and now shares his story to raise awareness. Stories like his, echoed by the Uganda Cancer Institute, highlight why knowledge is so powerful. This connection between certain practices and throat cancer is important, but you can take charge of your health. Consider vaccination, make informed choices, and embrace a healthy lifestyle to reduce your risk. Want my free guide to staying proactive about throat health? Grab it in the description. Hit that like button, share this with someone who could benefit, and subscribe for more health insights. Comment below, what surprised you most? Let's stay healthy together. See you in the next video.